A very warm evening to everyone. I am Dr. Barsha Pradeka, a research associate from under Project Core, which is a four-year program funded by NIHR UK. And in India, it is a collaboration between the Jamia Millia Islamia and the Public Health Foundation of India. And today, on behalf of the whole team India, I would like to welcome you all once again to our ongoing webinar series, which is today we mark our seventh webinar in line titled The Role of Artificial Intelligence in Dental Research. I extend a warm welcome to all the participants joining us from across the country and beyond. We are truly pleased to have you all today with us. Coming to the session today, it will explore the emerging role of the artificial intelligence in dental research, offering new insights into the innovations, efficiency, and future-ready practices in oral health. Before we begin, I would like to briefly share a few webinar etiquettes to ensure a smooth functioning of the session, which is kindly keep your mic muted throughout the session. During the session, you can also use the chat box to post up your questions, and there will be an opportunity to interact towards the end of the session. So thank you once again for joining us today. Now, I would like to invite our principal investigator leading team India from Project Core, Professor Abhishek Mehta. He is a professor of public health dentistry at the Faculty of Dentistry, Jamia Millia Islamia. Sir, kindly take the platform and introduce our esteemed speaker of today. Over to you, sir.
Thank you, Barsha. It has been our endeavor to, under Project Car, to listen to voices which are other than dentistry, and in that we are taking another step towards that. We have asked somebody who is not a dentist to talk on something which is related to dental research, and it's my privilege to welcome Dr. Narendra Singh Chaudhary. Sir is an associate professor of human resource management and organizational behavior and head of Center of Behavior Sciences and Leadership at Sparsh Global Business School, Greater Noida. He has over 15 years of experience in management education and has been associated with many institutions like Symbiosis International University, Amity University, SOIS School of Business Design, and his academic and research interests span human resource management, organizational behavior, higher education, and workplace ethics. So, sir has a very rich experience in collating the role of AI in research. We have listened to sir before in some other platform, and from there we got sir to talk with our dental colleagues, like how we can integrate AI, which is an emerging field and without which we cannot work now in various aspects of dental research. Over to you, Sach. It's a very hearty welcome from whole team core to you. Over to you, sir.
So thank you, Dr. Abhishek, first of all, for inviting me and for your kind words. So taking the topic forward, so we can discuss about the role of AI in dental research. So everywhere the AI is a buzzword everywhere. And we can see that in all the fields, whether it's medical, whether it's manufacturing, whether it's an IT, everywhere you can see the AI is getting, you can see the prominent role. So definitely the research is such an arena where definitely AI is making its mark, and definitely how we can have a ethical use of AI. Rather, I will say, and how we can do it and how we can augment our research in a better way, and especially in the medical field, how we can advance with the help of AI. We're going to discover in this particular session. So this will be the flow of the presentation. So we're going to talk about the research foundation first, and then the clinical applications where you as a dentist can have a clinical applications. We will going to discuss about the AI discovery phase, AI data phase, scholarly delivery, and how the research lifecycle integration can happen, you can say, with the help of AI. So when we talk about the research, the very simple truth comes is, what is research? things which are already available. We just want, we need to ask the right question. You can say, so research is all about asking a systematic question and finding a reliable answer to improve how we treat our patients, for example. Like whenever a patient is coming to you, so what you're asking, okay, he says that, okay, I'm having a pain in my teeth. So you ask not that why that pain has been there. So you diagnose it and then you try to give the medication and the treatment is being started or something like that. So the concept is basically when you talk about the research is moving from I think this filling works to I have a proof this filling works. So you are basically talking with facts, you are basically talking with evidence. So we can say that if I'm talking about the research or somewhat it is helping me to bridge, you can say it act as a connect between the dental lab to the dental chair. Now, whatever the research is happening all over the world and whatever the research papers actually we are reading. So you all might be knowing I think this is a part of the project, this webinar. So you're working on certain project, right? So that project is basically to identify some problem has been there, you're trying to solve that, right? How we can take, you can say, the dental, you can say research to the next level, how we can make the life of the patient or you can say people's life better. Because I think the kind of treatments that are available today, especially in the dental science, they were not available, you can say, 15 years ago or maybe 20 years ago. But over the period of time, it has improvised. And how it has improvised? Because the research is a continuous momentum has been there. A lot of research is happening and how we are trying to make it better and better day by day. Right? So now the you can say the procedures are less painful and definitely the fillings are less painful, you can say, and we have a better, you can say, systems, we are having better, you can say, mechanisms in place. So whatever the kind of things we want to do with the dental you can say health, we can do that, right? Whether we want to have a better denture, for example, I want to brighten my teeth or I want to do something, I can do that. So somewhat you can say the base of all these things is coming from the research itself. Now, if he says that, okay, if you apply this kind of a medicine or you will going to apply this kind of a procedure or a treatment, the outcome will be this. Some things are based on my experience. Some things are based on my observation, but there are some things which are based on evidence. So when I talk about the research, so I'm talking about evidence that, okay, what the studies have, what the studies are talking about and how they are adding to my knowledge base, because ultimately whatever the facts I'm having, whatever the evidences I'm having, I build my things over that. And that is how, as a in science, we used to ask the question that why should I trust you? So what is an evidence? So evidence is given by the research itself. Moving ahead, why does it matter? The significance is very important, safety. Now, first of all, so many new gels are coming. So you have to give me an evidence, you have to provide me that assurance that, okay, proving a new whitening gel doesn't damage my teeth enamel, for example. So ultimately, I will not going to trust just because, but if this thing is coming from a dentist, so and that to a practicing dentist, I may still, you can say, have a more trust. But in case that thing coming in an advertisement, I may not trust that. For the simple reason, because that is the simple advertisement. But if the same thing is coming from a dentist, I will trust that. So simple research has been there because they're practicing that. They know that, okay, these are the kind of findings that has been there. This is a proven formula, and if it has been used, definitely it will be better for the betterment of the patient. Now, the predictability is very important. Knowing exactly how many years a bridge will last. Now, for example, there were a lot many things we were struggling with, a lot many, you can say, things. But now we are having solutions to lot many problems which we were not having earlier. So you can say the research is making our task easy. Moreover, we are having a career edge. Now we are having a residency programs, for example. They look for evidence-based thinkers, not just fast drillers. So it's not only about ki, like you have to do the filling only, and in case the tooth is not okay, so I have to just pull it out and throw it away. No, the dentist job is much more than that. Right, we are talking about the dental surgeon, so somebody is doing into surgery, somebody is looking for many other aspects also, that in case a dental replacement, denture replacement has to be there. So what kind of things can be done, how we can make the teeth better, how the strength can be done, if the enamel is not working properly, what can be done? Because earlier the only solution was that, okay, you have to just pull out all the teeth from the mouth. But now we are having lot many solutions. So all these things are coming just because you can say the research is very, very significant, and those kind of projects are coming up, those kind of research is happening all over the world. And because that a repository is there which is available, you can say, to all the world, where we can access it, we can read it, and we can apply that, you can say, in our day-to-day life, or you can say in our profession. That is how things are becoming better. So definitely research has to be there. Now, when you talk about the research process, there's a 7-step map. Now, first is identifying the gap. So whatever the kind of research I want to do, first of all, I have to understand that, okay, what kind of problem I want to fix, or you can say, what problem do we see in the clinic? Like, for example, I was just listening to, you can say, a podcast. So that was basically, you can, on a study that why the sperm counts are coming down, especially in the males, you can say, while EDs are happening. So they're talking about the sexual health and all that. Now he says that, okay, we conducted certain research in 1993-94. And on the basis of that particular research, now it has become so advanced that even the people that are not having, you can say, like a sperm count is very less, but still they can become parents, because there are certain advanced techniques with the help of which that is possible. So what does it shows that, okay, there is a problem in our clinic that we want to fix. Second is a literature review. Now, the thing is, literature helps me to understand where the gap exists. Now, am I trying to address some problem which is very unique and nobody has talked about it in the past? Or you can say they might have talked about that in the past, or that about that particular problem, but still you can say not a very conclusive evidence is available. So in that particular case, so you can say the textbooks and the journals tell me that, okay, where the what has been done and what is supposed to be done. So what I've already done and what we can do further. Then we used to make an assumption, which is in the statistical language known as hypothesis. So we make certain assumptions. We make an educated guess that, okay, there is a significant relation of so and so, you can say X on Y or something like that, whatever we want to test, whatever the assumption I'm having. Then I have to talk about the methodology. That is a blueprint, or you can say the research design. So I can choose for quantitative methods, I can go for qualitative methods. And the third one, that is a mixed methodology, which is very, very, you can say, prominent nowadays, where I can get the quantitative methods also, and I can mix the qualitative methods, and definitely the richness of my study increases. Then comes the data collection. So I am having a lot of field work. I'm having a lot of x-rays. I'm having interviews. I'm having the patient history. So all these things are actually helping me to, you can say, to analyze this particular data which is available. And with the help of that, you can say I can analyze the collected data, and then I can turn this raw data into the insights, that is the truth. And finally, I can answer the original question, whatever the problem I was having in the very beginning. So you can say it's a very step-by-step procedure, and that I have to, you can say, focus upon. Now, when I talk about the researcher's compass, the researcher is having 3 ways. Either he or she can go for quantitative methods, that is measuring hard fact, that is where we are talking in numbers. Like, for example, what is a percentage? What is a number? So how many percentage of people say that, okay, the dental hygiene is very important. So somewhere I'm talking about percentage, somewhere I'm talking about numbers. When I'm talking about the qualitative, that is the human experiences. You can say the narratives. What people experience, what people feels, because that cannot be captured with the help of numbers. Because there's a, you can say, limitation when I talk about the survey research, which was because largely quantitative is survey based, but there are not many things. That is why certain things are happening, why this thing is happening, why X is happening, or why a particular phenomena is happening. So that is all about exploring the human experiences. That is the words. So what we cannot capture in quantitative studies can be captured from qualitative only. So you can say we can get the good insights about the human experiences, and that we can capture. And then if we combine both, you can say for the 360-degree view, which is one of the best way to do that, we can club both quantitative plus qualitative to get a more holistic way that, and we can move ahead. So these are the 3 ways through which we can do. You can say the study we can go over, or you can say the research done which are available. Now, the quantitative research, when we talk about the scale, so definitely my goal is to test my assumption or hypothesis and make a mathematical predictions. So I'm having a statistics, I might be using mean, all right, or a median, or you can say a mode. So largely I'm using the mean values at times to predict. So I'm using, you can say, regression. I might be using a central tendency measures, you can say, mean, median, mode, largely when you talk about. So I can go for a correlation. I might be going for a regression. I might be going for the rank correlation, depending upon the kind of, you can say, the data I'm having and what kind of research I'm doing. So data type is largely numerical and objective. Like for example, 30% of students have cavities. Now this is numerical data. Because you are evaluating the things in numbers, 30%. Experimental, now what you can do, you want to test the effectiveness, so you can say, of two toothpastes. So you did an experiment, you make two groups, group A and group B, and you administered, you can say, both the toothpaste, and then you took the data, you took the sample, and then you are testing it. So somewhere you're comparing. So I can go for ANOVA, for example, or I can go for independent sample t-test, depending whether your data, you can say, is whether your data is normal or whether your data is not normal. If it is normal, I will go for parametric test. If the data is not normal, I will go for non-parametric test. So quantitative research is talking largely about numbers. So when you talk about the quantitative, like for example, orthodontics, now the problem could be, do clear aligners move teeth as fast as metal braces? Now this could be a problem statement for me. I would like to study this. Now, what could be the method? I could use measuring movement in millimeters per month using 3D scans. That could be one way. Or outcome could be numerical proof of efficiency, that whether actually it is working or not working. So you can say that everything is evidence-based. I'm having everything in the quantification. I can quantify, you can say, in the quantitative research. I'm having certain cases that, okay, in how many cases the results are showing that, okay, this drug is effective, for example, or this procedure has been very, very successful. So like for example, so that is, so this is all about quantitative. When I go for the qualitative research, that is basically about the storytelling, that you can say the narrative that we are trying to tell. That is to understand the concept, thoughts, or experiences. Now, the data type could be text, it could be an audio, it could be subjective. You can say I have taken interviews, so I'm having, you can say, transcripts with me. So whatever the people have said. So like for example, I can go for phenomenology. I can go for a case study. So I may take any special patient as my case, and then I can write, you can say, a case study on that. That, okay, this is a rare case which has come to me in my career. Like you all will agree as a dentist and as a doctors, like there are certain cases which are actually very, very challenging at times. And that actually like forces us to like explore lot many, you can say, ways to treat them, and that was very difficult case. And from that particular case, you can say, we learn a lot, or we explore, you can say, certain some more things, that okay, how we can, if such kind of cases are coming, how we can treat such kind of disease, for example, or how we can treat such kind of patients who will going to come to us in the future. So you can say this is a case study. Phenomenology, for example, I want to understand a phenomena, that why are certain things happening. So generally, I want to study a lived experiences, that is live with dentures, like the people who are having dentures. So how do they feel? So I want to know their feelings. I want to know about their actual experiences, and I want to report that. And based on their whatever the experiences they are sharing, you can say, what are the themes that are coming out? What are the findings I'm getting? What I can do, I can make my products better. I can make my things better, my treatment better. That okay, what I can do so that the life of my patient can be better. Right? So it could be cases also, because generally you're having a lot of cases, the patients are coming, so they're largely a case study for you. So definitely we can analyze those patient summaries also, and we can understand that, okay, what kind of diseases are coming, and there are certain rare reports also, definitely that can act as a case study. And in your reports, at times it happens that you say that, okay, this is a very special case that has come to me. I have never experienced such kind of case, but this is in front of me. So such kind of cases are known as case studies. So there are many ways, you can say, in which we can proceed with the research, you can say. It could be a case method, it could be qualitative, it could be quantitative. Now, dental phobia. Now, for example, why do patients faint at the sight of a needle? So especially so when you want to inject, you can say an injection, so definitely they might be having some kind of phobia. No, 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 doctor sahab, good medicine de dijiye, but definitely I don't want to have an injection. That means they have a phobia. They collapse at times. So what we can do, I can go for a deep interviews with 10 phobic patients to find trigger themes that okay, why they don't want to take injection and why they faint by seeing a sight of a needle. Now, this sounds very simple, but understanding the psychological why. So, this why question is getting answered with qualitative. But what is happening? How X is impacting Y? That is quantitative. But why X is impacting Y? That is qualitative. So, the mixed methodology design, the hybrid way. So, the goal using numbers to show the effect and words to explain the cause. That okay, X is impacting Y, but okay, they are impacting each other because of this particular reason. So that reason can be given to me with the help of, you can say, qualitative. And that is why nowadays I am using mixed method designs. So if I talk about design, so explanatory or exploratory. So when I want to explore, I am basically saying qualitative study. When I'm saying explanatory or descriptive, basically I'm saying quantitative. So in explanatory, you can say numbers first, words second, and in exploratory, words first, numbers second. I hope any questions you please just put in your chat box in case some questions have been there. Like for example, this is a case study, teledentistry. So if I'm saying the accuracy of diagnosis via video, now this could be a case study. Like when I am having a person in front of me or the patient in front of me, definitely I can diagnose it better. But how I can do the same thing on video? So what is the level of accuracy, for example? The qualitative question could be patient satisfaction interviews, for example, words. So teledentistry, I want to know the patient satisfaction. And also I want, and in the quantitative study, I want to know about the accuracy. So the full picture of whether the technology works and the patients like it. Because ultimately, teledentistry will only work when the patient is satisfied. If they are not satisfied, definitely they will not going to come for the, you can say, teledentistry. So we have to see that whether this method will actually work or it will not, right? So in this particular case, so you can see that we have mixed both, that is patient satisfaction plus accuracy diagnosis. So one is telling about the quantification, so another one is talking about the quality, that is about the number and the words. So when we club both, so we get a full picture that whether it is successful or not and what are the reasons behind that. Now, if these are the studies you want to do, let's see the AI tools that make them 10 times faster. It makes my works faster. All right, so step one, first of all, like I'll just show you the tools also. First, I'll just finish the theoretical part and then I'll come to the tool. So step one, if I want to identify the gap, for example, so research rabbit and answer this, these are certain tools which I can actually use and I can go with it. So visualizing how papers are connected, because largely research gap is very important. So whenever you are doing your PhD especially, so they generally used to ask that, okay, you want to do research on this particular topic, why? Now that why question is basically coming from research gap. Now that research gap is basically coming from the literature review. So the task is to visualize how papers are connected, what has been done and what has not been done. So whatever has been done is fine, it's fine. I can't do anything about it. But what has not been done, that is basically my scope, or you can say that area where I can actually bridge, you can say, I can build my research. So detailed function, you drop two seeds papers in and the AI builds a galaxy map. And if you see two clusters of research that aren't connected, that is your gap. That means there are certain things that which are not connected. So you can say this X and Y has been studied, but X and Z is not studied. So that is my gap. Or if I want to say X and Y is studied or X and Z is not studied. So I can make a model out of it. Okay, certain kind of relationship has been studied, for example, and this is not studied, or you can say the population was very different. Some studies has happened in the UK or maybe in US, but that has happened in the in India, for example. So definitely that's a gap because the population is very different. All right. First of all, the culture is also very different. There are many other factors that are actually impacting your research. So there are a lot many factors that we have to identify, and we have to make sure that we can identify the gap properly so that we can build our research properly. So if that this is the very first step, and that is identifying the gap. So introduction to AI. So AI involves using machine learning and NLP techniques to assist in various stages of research. Relevance, it automates my repetitive tasks. So you can just say that it is my personal assistant who can just do a little bit groundwork for you, but ultimately you have to do the actual work. Enhances our accuracy and efficiency up to a great extent, but definitely you have to validate it. You have to verify that. Provides insightful recommendation for the content improvement that, okay, this is what has been there, but this is missing. You should work on this. So definitely it makes your work little faster. It improvises your work, but ultimately you are the final decision maker. AI will not going to take decision on your behalf. That's one thing. Now, these are the role of AI in research writing. For example, I can go for topic ideation. I can go for LR. I can go for structuring manuscripts. I can improvise the clarity and coherence. I have done a lot in my research papers also. Then there are citation, the reference management also. And these are certain tools for writing. Like ChatGPT, we all have heard a lot about it. Gemini, we have heard a lot. Cloud is one that is very popular nowadays, right? Jasper is there, Grammarly, Quillbot. So these are various, you can say, tools which have been there for writing. So you can say we are having a different AI tools for different purposes. Every tool is going to do everything? No, it's not the case. So some are more reliable, some are less reliable, you can say. But yes, there are a lot many, you can say, tools which are available nowadays. Now, if I want to go for a literature review is actually a painful, you can say, process, because you have to read a lot and then you have to identify the gap. So definitely sifting through vast amount of data and identify gaps in themes is a great challenge. What we can do, we can easily identify the gap. So as I told you that with the help of answer this, I can do that. And even after that, so these are certain AI solution. I can go with connected papers. I can go use Elicit. I can use Research Rabbit. I can use Semantic Scholar. These are certain AI solution or tools which I can use for literature review. Now, clinical fact checking, that is consensus AI. This is a very beautiful app, and definitely this will be very useful, especially for the dental research. That is consensus AI. So, for example, it will going to search 200 million peer-reviewed papers. Now, for example, you have to give a prompt and ask, for example, does charcoal toothpaste damage enamel? Now, this is a very simple question that I'm asking. So, it gives a consensus meter showing that what percent of scientists agree. So you can get some kind of data, you will going to get some kind of facts also. Speed reading. Now for this, you can again use the answer this. So now even in the PDF also you are having, you can interact with the PDF and that gives you a summary, or you can say the gist of the PDF. You need not to read the entire PDF. So it will going to help you. So you can summarize the results of this 30-page paper in 3 bullet points. So it provides clickable links to the text, and so that you can lie to you. So you can keep it, you can say, by your side, and it will give you a kind of a summary. And then you can make a reader summary, and later on you can put it in the literature review. So somewhat you can say, rather than reading 100 papers, it's very difficult for me to read 3,000 papers, for example, on average. So what it's helped me to do, if on average, if there's a 30-page paper or an article, you can say, what I can do, I can summarize it, and after summarizing it, I can read it. So that helps me a lot. Even Scopus.ai, so Scopus is a large, you can say, database which we are having for the journals. Even Scopus.ai is providing this kind of facility where we can just run a query that, okay, I want to research on a particular topic. It will going to give me, you can say, the gist of all the papers, maybe if, whatever the papers you want on a particular topic. You have to just give the keywords and automatically the abstract and the title and the papers will going to come to you, and it will also going to summarize for you. Then drafting a synopsis. So yes, I can go for cloud. I can go for ChatGPT, Gemini, Perplexity. I just show you the this. Ask the AI identify the potential bias in a study comparing two different composite reasons. It acts as a methodology consultant. That, okay, which one will be better? So it will give you that, okay, as per me this is better, but ultimately you are the final judge. That, okay, which method I would like to go with, or which methodology I would like to go with. Qualitative collection, like for example, Diagnocot or Pearl is there. So what you can do, you can automate X-ray analysis. So what will happen? The AI scans 500 X-rays and identifies caries depth and bone loss in millimeters instantly. Like for example, in China, they have opened, you can say, AI hospital. So you just go there and they are treating more than 10,000, you can say, patients in a day, even more than that. So it is fully AI based. No human doctors have been there. So you can say the accuracy is almost, you can say, more than 95%, almost 98.99%. But still the doctor is important because ultimately the AI can commit mistake. To avoid that mistake and to see the quality of the analysis, the doctors are still needed. So ultimately, you can say it has to be in combination both the human and the AI. So for example, if I want to go for instant transcription, now for example, you are conducting a study and you are conducting an interview. Now it is very difficult to take the notes and write everything. What you can do, because I personally used it, Otter AI and Fireflies. The name sounds very little different, Fireflies. But what happened once you make your account on it? So whenever you're conducting an interview or a meeting, it automatically starts getting recorded. And once the meeting ends, the entire transcript comes in front of you. What participant one has said, what the other person has said, and in this way we can record, you can say, everything into it. So it makes my work comparatively easy because I'm having a transcript and now I can easily, you can say, analyze it. Otherwise, just understand writing all on your own, then making it better finally, and then analyzing. It takes a lot of time, but it is saving my time. I can have an online interview, for example. Like for example, Basha, you could have an Otter AI. So whatever I am saying, it could have transcribed here itself. So
Okay.
even Zoom is also having this facility, Zoom AI. So they are
Yeah.
having this facility where it will automatically get transcribed, right? So this helps us a lot. So I can go for the qualitative collection like this. Then detailed function recorder interviews, the AI types it all out and highlights emotional or anxiety keywords automatically. That means whatever the themes I want to identify. So it makes my work easy. Then, for example, advanced analysis I want to Julius AI is one software which I can go for. So that is the chat with data statistician. So upload an Excel sheet and say perform a t-test, create a high resolution bar chart. So I was teaching BRM to my students in PGDM program. So what I have done, they were doing it with SPSS, I was doing it with ChatGPT. So whatever they were doing it, I was already having the results with me that okay, this should be the result with you. Although they cannot rely on AI because they should know the manual procedure also. So we have to verify that whatever the AI is given and whatever we are doing with the help of the software, are they same? So that has to be checked and verified by the human. So no coding or complex math is required that okay, I should know this particular statistics, then only I can run the test. Now, for example, fixing dental English, that is the worst thing you can say. We are native, you can say we are Indian natives, right? English is not our first language. It's a problem. So if I have to make my English looks like better, like a US English or a UK English, definitely I need some help. So earlier I have to go to some professional who can actually rewrite my paper and then it has to go for publication and all that. Right now, I no need to go for that. I can simply go to PaperPal, I can go for Grammarly, I can go for Writeful. So these are certain tools with the help of which I can definitely make my paper better. I don't need any expert. I have used Grammarly very thoroughly and it works wonderfully well. Wonderfully well. Grammarly, PaperPal also the same thing, and there is one more tool that is Strinka AI. I will show you that also. So dental English. So it corrects technical terms. Example suggests carrier's lesion over tooth hole to ensure a paper sounds professional. So better choice of words can be there definitely. And AI across the research cycle. We can say that. So this is, so in case you are early research stages, so we can go for topic discovery. You want, the purpose is to go for identify research gap in ideas. I can go for, these are the AI tools that you can use. Elicit is their perplexities, their consensus is their chat GPT. And what you can do, you can generate research question. You can explore topics and identify gaps, for example. You can go for literature review where you can find and screen papers. So you can go for illicit, you can go for consensus, semantic scholar, research rabbit, corrected papers. So this will going to help you to search, filter, and map academic literature. What has been there, what has been done, what has not been done. Then paper understanding. Paper understanding can be better. So we can read and summarize papers. That's one thing. Then for that, I can go for SCI space. I can go for Scholar C. I can go to Humata. I can go to Chat PDF that is available. So this will summarize PDFs. I can go for citation analysis. So I can go for SCite that support contrasting citations. If I want to go for concept mapping, I can go for research rabbit, corrected papers, and lit maps. So it is helping in mapping relationship between various studies. Then referencing, that is a tedious task. APA करिए कभी शिकागो में करिए कभी हार्वर्ड में करिए सो मेनी स्टाइल्स हैव बीन देयर राइट एंड इट्स अ task I mean अपने आप में if I have to do the referencing especially 40-50 papers are there and I have to do that so now even the Zotero and the Mendeley they are also coming you can say with the AI and even with the chat GPT also you can easily do that right so you can store you can cite you can manage references very easily and recently also one more literature reviews there you can make an entire paper within 15 minutes not even 15 minutes 5 minutes SLR systematic literature review so AI is you can say doing lot of things but we have to understand its limitation and we have to step in there right? So again, the same advanced research tools, you go for chat GPT, paperpal and all this for one. You can go for data analysis qualitative. So NVivo is there, Qualcoder is there, Python and statistical analysis and modeling. I can go for the coding and thematic analysis. I can go for visualization. So as you could see, these are the various ways through which I can go. So this is very important. Scopus AI. If you are having a subscription at your institution, this works very well. So please do try this Scopus AI. So you just type a query that, okay, I want research papers on this particular topic. You have to just put the keywords and you're going to get the entire list of the papers that have been published in that particular domain. Latest. So that is the best part. And moreover, it also suggests you framework and the what are the kind of variables have been done. And then again, the Elsevier AI also has been there. And even and now there's a task for the researchers that, okay, where should I put my paper? Now, this is a new feature which has been added as a journal selection. So you go to Emerald website, for example. So there you can see that, okay, whether my paper is complete in terms of submission readiness. So what I can do, I just upload my paper. It will go to scan my paper. It will tell me that, okay, these are the issues as per the requirement of Emerald Publication House. Kindly fix it and then upload it. So these are certain things which have been happening and because it saves lot of time, right? And even when I put it, okay, this is my topic, so suggest me journals. It do that. That okay, these are certain journals which you can look at. So it will go to align your things with the particular kind of journals. So ethical guardrails, privacy. Never upload patient names and faces to public AI because the data can be stolen. Because you are not there to train data, so you have to make sure that anonymity is been there. All right. So either you are using the paid version and there is a kind of a contract and agreement that okay, whatever the data you are uploading that will not be leaked anywhere. Right? Otherwise, don't do that. Then the co-pilot rule: AI proposes, the dentist disposes. Always verify. So don't trust AI blindly. That's one thing. Limit AI usage for content generation. Or you can say, don't try to create content out of it. Use it for brainstorming, use it for outlining, and use it for initial drafts. And then please refine it on your own. Because definitely AI is not there to, you can say, replace you for that matter. Because the AI is not having that kind of intelligence which you are having. Then refine and personalize content through manual editing and critical thinking and develop original arguments. Focus on your own research findings and critical analysis rather than relying on AI. AI give any nuisance and any crap, to be very honest. But you have to make sure that whatever has been there, it is verified, it is authentic. Authenticity is very, very important. Like recently, there was a case in which the Deloitte, what they have done, they prepared the report with AI and submitted to the Australian government. $4 lakh fine was imposed on them Because whatever the research report have prepared, that was prepared by AI. So that means there is no sanctity or bad research. You cannot rely on that. So your reputation comes at a risk if you are using it blindly. So you please make sure that you have verified the things, whatever you are putting on AI and whatever wherever you are using AI. So final thought and conclusion, research isn't about being the smartest, it's about being the most curious. So we have an inquisitive mind, have more inquiring mindset. Whatever you want, there's a problem you want to solve that. For that, the research is basically been there. So it should be a, you can say, a general or you can say general curiosity that you want to have. AI just your new high-speed vehicle, all right? But ultimately, you are the driver. Driver is you. Avoid over reliance on AI tools. AI can be a powerful aid in research and writing, but ethical, responsible use is essential. Because if everything AI will use, then what you will do? Then what is the need of doing research also and putting your name also? Then also put made by AI only. Wait. Right? Then treat AI as a support tool, not a substitute for original thinking and analysis. So definitely critical thinking and the originality cannot be taken away from by the AI. Always attribute, paraphrase effectively and ensure content originality, which is the biggest concern you can say of the AI. So be cautious, use it definitely. These are the things which are here to make our work easy, but definitely over reliance can be fatal. I will say fatal. Reason being because if you are not verifying the things, it will be difficult, right? So now we're going to have a particular exercise on various little bit tools just to give you because in 1 hour you can't do everything. But we just try to take. So in case you are having any question, you can put that. I'll take that.
Don't think so. There are any questions. You can carry on with the hands on. Sir, unmute your question.
Yeah. Any question that you are having, I will take that. Or otherwise, I can go ahead with this only.
We don't have any question in the chat box. Yeah, but yeah, no. I think you have answered most of the questions which were there in my mind. Like
Okay.
obviously there should not be an over reliance to what we are doing. We have to humanize it.
Right.
It's like okay, we write a research paper, but we just cannot submit it. Anyway, we have plagiarism check, which includes an AI component, which will catch
Yeah, so definitely we
in
are
an instant.
having Turnitin nowadays,
Yeah,
which is also having
like,
an AI, but it is also having its own set of issues currently
yeah.
because even you are writing on your own, but still it's showing that it's written by AI. So still AI is as a crossroad where you cannot actually trust it completely. Definitely it is making my work easy, but I know that how many prompts and how many times I have to make it. And definitely when I'm giving 5 or 7 prompts, then it is giving the actually you can say the content which I'm looking at and still I have to work on it.
Yeah,
So
the
as I
example
told
which
you,
you gave of Deloitte, like, suppose if I am doing I am having some idea, but the study has already been done, AI will show it as my study. Like if I tell that, okay, you write a study protocol for something, it will show it as my study. And if you submit, it will like a fatal mistake. What you have given the example of Deloitte that they have submitted a report using AI. If some researcher do that, they'll be caught and obviously it's not their study, but AI is making it as your study. That's what I can
yes.
understand.
So
Yeah.
at times it happens, like I tell you, like I had my own research papers and
Mm.
it gave some other references, you can say, which you can't even rely upon.
Yeah.
So there are a lot many things I think we need to work upon. So I'll start with chat GPT first and I'll take any particular topic anybody would like to like put in the chat box. I can take that in case. Otherwise, I'll just put my topic only. Now, for example, this is the topic which I want to research upon, right? So, is vitamin D linked to implant success? Now, I am giving a prompt, create a research proposal of, for example, I'm going for mixed methodology Or let me go simple first. Let me just go for qualitative methodology. I want to do that. Now it is analyzing and it will going to give me an academic, and now just see. It has given me a particular background, like for example, ki dental implant success influence. So why I want to do? So because it's a qualitative study, I want to know the clinical perspectives, decision-making process and experiential insights of dental professional regarding vitamin D and implant outcomes. Now here I will going to do, you can say the interviews largely. I can go for focus group discussions. Now it all depends. Now this is a research problem. So because you people all are dentists, so you can understand whatever it has generated, is it making sense currently? It is making sense up to large extent. But when I deep down certain things, now you can say, despite emerging evidence with linking vitamin D levels to implant success, there is lack of consensus among practitioners. Some agree, some disagree. Limited qualitative understanding and unclear integration into treatment protocols. Now, I want to understand, explore perception to understand how vitamin D consideration influence treatment planning. So these are my 4 research objectives, you can say, and these are certain questions. Now, as a researcher, now they have said that okay, for this interpretative paradigm will be better. So that is why it has suggested me phenomenology. Phenomenology is all about lived experiences. That okay, I have actually lived that experiences. And why I'm going for purposive, I'm not random, because here I have a choice to choose only those, you can say, samples, or you can say respondents who actually have lived, you can say, this kind of thing, because that is an actual audience who can give me the right kind of insights. So they said purposive sampling, fine. So now just tell me, the participants are talking about ki implantologist, oral surgeon, prosthodontist. Are they the right participants for this particular study? What do people say?
Yeah, if you are looking for professional
So
aspect
yes,
only,
it is,
they
right?
are okay, because
Right.
if you're
So
looking
you
for
can
patient,
say,
then patient will be included.
absolutely. So now you can say it has already given me this methodology. So up till here, it is going absolutely fine. Now, it is giving me themes also: awareness of vitamin D, clinical protocols, experience with implant and failures, patient. Now, this will going to come, especially when I start interviewing them. Once I'll interview them, I will analyze the data and then I will going to get the results. Now, the data collection could be interview guide, audio recordings, field notes. I can go, and this is the data analysis, thematic analysis, like for example, trustworthiness, member checking, audit trail, and all this consideration. Expected, this is significance is this one. Now it has given me a proper proposal. If you have to make it on your own, how much time will it take? Right? Now, similarly, if I'll say that, okay, I would like to go again. He suggest a quantitative study proposal for the same. Now, I would like to go with association between serum vitamin D levels and dental implants. Similar thing, when I want to go with qualitative, the same study I would like to go with the quantitative also. Now, just see association between preoperative serum vitamin D levels and implant success. So you can say the language is very refined because the AI is also now somewhat trained, and it is working fine that ways. Hypothesis: patient with sufficient vitamin D levels show higher implant success rates. And these are the assumptions which I have made. Design is prospective cohort study. That means I can make an experimental group and then I can do the study. Population, now you can say 120 to 200 patients based on power analysis, and consecutive sampling, patient undergo dental implant procedures. So it has given inclusion criteria that only adults, you can say more than 18 years of age will be eligible for it, because there are certain ethical consideration indicated for dental implants. Now this could be an inclusion criteria you can put, for example, and then independent variable could be this serum vitamin D levels and then implant success. So these could be the control variables: age, gender, bone density. I could make that. Now, whatever actually you want to do in your study, you can design that now. Right? Now, for example, now these are expected outcomes, and it has given me a plan that what you can do. If I say, give me the same for mixed methodology. So I'm taking the same topic, but I have shown you for the three: quantitative, qualitative, and now this is a certain thing. Now see, vitamin D and dental implant success mixed method study of clinical outcomes and practitioner perspectives. Now this is becoming more, you can say, rigorous. You can just go with the introduction. While quantitative studies examine measurable association, they often fail to capture clinical reasoning, contextual decision making, experiential insights. A mixed method approach provides a more holistic understanding. So research problem has been there. I want to go for research objectives to integrate quantitative and qualitative outcomes, and this is the qualitative. Is there any relationship? How do clinicians perceive the role of vitamin D implant success? So now you can see they have merged both the insights into both the methodologies, and now they're working. Design, quantitative, and this is qualitative. I can go prospective cohort, and then again blood test, serum, chi-square, ANOVA, logistic regression I can go with. So it has now in qualitative phenomenology. So now it has, you can say, merge both the methodologies, and it has worked like that. So I hope this is clear to everyone. Now, for example, I'll just show you one thing that how I can go with the transcription. Now, this is one particular study that we have done on sustainable fashion. So I am just taking that particular transcript. So what I can do, I can just have some 2 to 3 transcripts. And the topic, this paper is already published. So the topic was that why millennials want to opt for, what are the motivators or demotivators for millennials to opt for sustainable fashion. So these are the transcript that we had. So I'll just show you one. So these all are the transcripts. So I'll just show you one. Can you see this transcript? So these all are the interviews that were taken, you can say, online. And then that is being converted with the help of AI. So this is how it appears. So now see, it has made my work easy. Right? Can you say this? So timing is coming. So authenticity increases. You're having a data. And any point of time, I can just refer to this particular transcript. So this appears. So you can do. And this is transcribed by Otter AI, which I gave you this example. Now, let me come back. Now, I said that, okay, analyze the transcripts and give me first order, second order, and final themes in tabular format. Can you see this?
Yes.
So I can do this, but what should I do? What I generally do, I do it manually, and then I do it here, and then I map it. And then whatever, because AI may miss few things. But as a human eye, I can catch hold of that. So you have to use both AI plus your human decision, you can say human insights, and then you can make it and say this is how the themes appears. And I can make it final later on. Now this is the final aggregate themes. In actual, the themes which we have identified, they are a little different. Some are same, but some are actually different. If I'll show you this paper, I will share this paper. So you will going to see it is a little bit different. So nomenclature could be different. You can say the theme's name could be different because that you will decide which one is better. Right? So this is how we can do it. Now, for example, in the chat GPT, there is more function that is about the data analyst. So now, for example, I want to do a particular, I'm having an Excel sheet or I'm having a data with me. So I'm having a data, so I'll just show you how it works. No, I'm having some certain data files. So I'm just taking a particular data, data set I'm taking. And give charts, for example, mean values, etc. Just for the sake of just analyzing, I'm just showing it. So that I can do. So this is only with ChatGPT. I'm showing that from ChatGPT also you can do a lot. Similar with the Gemini. ChatGPT is somewhat you can say have the better functions. So this is a CSV option they have given. So they're asking for CSV and XLV. So I am uploading now CSV file, for example. So this is a XLS file. The format has to be there. So I have given it. Let's see how does it works. Now it is analyzing it. Okay, in the meanwhile, it is analyzing. I'll just show you one more. So this is answer this. Can you see my screen?
Yes, we can.
Right. So you can see there are a lot many things which you can see here. Find papers, do literature review, data analysis, research gaps, paper chat, extract data, paraphraser, AI writer. You can say this is a very holistic kind of a tool which you can actually use.
Yeah.
Answer this. Very beautiful app. Now, for example, you can say, what is the latest research on Alzheimer disease? Right? I'm just putting it. Now I have given a particular question and now it is going to give me the question answer. And in the meanwhile, you can see this chat GPT results have been there. Customer satisfaction. You can see the bar chart has been there. Repurchase intentions have been there. Key summaries, you can say the mean values I'm having. Median range is there. Skewness, repurchase intention. I can get lot whatever I want. I can have it. And even the insights can be there. There's a clear issue with customer satisfaction, which likely impacts repurchase intention. So I hope it is amazing to to see all these things, right? And you can see now I am having all these. Can you see these papers?
Yeah.
What is the latest research? So it is showing breakthrough blood biomarkers, new disease modifying treatments, combining therapy approach, mechanistic, and these are the abstract. You can see this is the paper of that particular person who has written it. So what I can do in case I want, I can just click here. I can save to a new project I can make and a folder will be created there. You can just keep on saving the files and later on you can refer to that. Right? This is one thing. And here, if I want to just know that, okay, what the paper is all about. So you can say this is an abstract which I can see. Right?
This looks like a
Alzheimer
better tool
plasma biomarkers that
for
transform the field.
this looks like a better tool for researcher than say just
Yes, yes,
GPT.
it works
It
very
has
fine because it's a free
yeah,
version I'm just showing. So
yeah,
it
no, but
has its own
yeah,
limitations. And then now, for example, I just want to like go ahead. If I want to go for default, what is the latest? So it will going to give me lot many options. I can do lot many things, right? Now webinar, I can go for the literature review, for example. Now I want to do literature review. Like review of machine learning application drug discovery. Now it is giving me. Query sent. So it's still in progress, generating. So you can see the papers are coming on this side, right? As a document manager, you can see here,
Yeah.
right? And even the authors, and these all are, you can say, now you can see this is a, Barsha, how much time you will going to take to write literature review this much?
Almost a month.
So at least I'll be needing some time, right? At least some days. Now you can see it is making it. Interesting. This is one. You can just put your topic, it will going to come. Entire paper is ready. Now you will ask that what we will do, you have to verify it. And you have to
Yes.
rephrase it also.
Yes.
Right? So this is how it can
But
work. Now you can see the entire paper is ready.
just to like with the paucity of time we have,
Yeah,
uh,
yeah.
the in the chat GPT, the question which you have put, the vitamin D and implant, actually it cannot be a qualitative study. It's not a very scientifically correct or scientifically viable thing to know vitamin D level and implant success from a qualitative point of view. But
Yes, yes,
still,
yes.
chat GPT is generating it. I'm just pointing out
Right, right, right.
how as a researcher we have to be cautious when we are using it. This looks beautiful, and definitely it will save a lot of our time.
Yes.
The answer
So
that
at least it
correct.
will give me a blueprint and I can
Yeah,
actually work on that. So that is a beauty because I don't need a personal assistant ki tum literature review karke
correct.
mujhe do and then I will do
Yeah,
Mm.
anything. So I think that
exactly.
saves my time. And similarly, one more very important and very good tool is like Trinka AI. So it works
Okay.
just like a Grammarly, but definitely it improvises your language also.
Okay.
So you can go with Trinka AI. So you can see like my reports, plagiarism check can be there, AI content detector can be there, citation journal. Even you can go for journal finder. So it is having this function also. Like for example, you want search, you can just paste your abstract. It will
Yeah.
going to tell you the journal, choose from top 5 journals, whatever you want to do. So paste your abstract here and it will going to help you to search that. So journal finder is one thing. So these all are, and like for example, elicit, I told you, you can either again put a research question. So there are a lot many tools, as I told you, lot many have been there which you can explore. So definitely lot can be done with the help of AI. It makes our work easy, but as I told you, not to follow it blindly. Not to follow it blindly. So that's all from my end. So any questions are welcome.
Not sure. Any
Uh,
participant has question, or that's why you have a
mm,
question.
Nothing is there. Is there any questions from the participant side? You can unmute yourself and raise your queries.
I think I have. It is actually not a question. I just want to add because there are many AI tools, which are dealing with research, of course, right? Like ChatGPT, but it is important where the data is coming from, like the repositories, right?
Right.
So with ChatGPT, I think it's an open end source, right? And
Mm.
AI tools, they hallucinate as well. So
Correct.
any which way we have to cross check, right?
Correct.
So I just wanted to ask you a question. You were just demoing the answer this Wala AI, right? So
Right. Right.
may I know what are the repositories and uh, where is the data that is coming from and it is giving the answers from?
Okay.
I
So
just
see, when
have
I
that.
talk about, for example, answer this, so it is having a connection with the large databases of journals, right? So it is picking from the open sources also, largely open sources which are available, you can say, or maybe from the ResearchGate also, there are so much open data which is available. So whenever you're putting a particular query, so abstracts are available everywhere, right? So largely it is picking up from the abstract also, and then it is making it. And moreover, the you can say the links are verifiable. So still it is, that is what I said, it still has to be verified. So largely you can say answer this is reliable comparatively. Chat GPT, I think somewhat sometime back it was working fine, but now it hallucinate more. So the point is the data has to come from you as a researcher, for example, and for that matter, like Scopus.ai told you, or Elsevier.ai. Now these are the basically the journal, you can say Scopus database is there. So in the library, you can go and take the data from there. So definitely that is basically based on the kind of research journal, the repository which is available. From there, the data is basically coming. And in the chat GPT and all, because mine is paid version, so that is why you can see all these functions. In the very generic one, you won't find this data analysis and all that. Very restricted part has been there. So either we are having, you can say, a kind of an institutional agreement where we can use OpenAI and definitely our data will not be misused. Or otherwise, in case you are using it, you can just do it. Okay, like very careful. You have to, because at times ChatGPT generates, you can say, that kind of references which are actually not even existing, or the details are not okay. So you
Yes.
can say if the 10 references are generated, there is a possibility that 4 or 5 may be wrong, right? So definitely your work you can say has increased a lot too for verification purposes. Very important, very very important.
And if I may add, please correct me if I'm wrong, Dr. Naren. Can we put a prompt like we want the citation only from peer review or information from peer review journals?
Right.
If we put that prompt, it will give us better evidence, which the participant has pointed out that it will remove any uh, open source or newspaper or something which is
Right.
not verifiable or which will not provide very good evidence. Maybe that will help.
See, largely what happened, like Dr. Abhishek, when you are using all these particular tools, there are certain limitations to it, right?
Yes, yes.
Yeah. So what is happening? That's again I tell. Just wait a minute. So we have to just understand one thing, that whenever we are doing certain things, the cross verification has to be done.
Yes,
But
sir.
largely when I go with Scopus AI, for example, so in the Scopus AI, it's very simple because the data has been pulled, you can say, from whatever the repository of all the Scopus
Yes.
papers they are
From the
having.
scope person. Yes,
So that is very
definitely.
authentic, because
Yes,
when you ask a librarian to do that, he or she can
yes,
easily do that.
yes,
And data is very, very reliable,
yes,
right?
yes, yes,
Now, what you can do, like for example, in answer this, the entire paper got completed, right? That I
yes,
put that, okay, give me a literature review. Entire paper was there. Now, first of all, read that paper and then see the links which are available. That are they verifiable
yes, yes,
links? All right. And if they are verifiable, and then you have to see that, okay, whatever the has been there in the paper, is it actually reflecting the same thing, or it is just putting something of its own? So at least randomly, I should check certain things, that
yes,
whatever has been put, whether it is authentic or not.
yes.
Right? So
Thank you.
largely, Abhishek, many are free. You can say up to certain extent, but after that they start asking for money. So because that's their business, so I don't think there will be a
Yeah,
very free kind of thing. Because free are they have free version, but yes, it comes with certain limitations. Certain limitations have been there. So you can say AI is a huge world. You can say lot many tools have been there. So you have to pick one which actually serves your purpose. That's one thing. But ultimately, the human eye is very, very important. Validation has to come from you, not from AI. As simple as that. Especially as a dentist, where the human life is involved, I will say that
yes,
human, you can say the patient well-being is involved. So you have to double assured, for that matter, that whatever the treatment we are administering, or you can say whatever the drug has been administered, or you can say whatever the research has been there, it is done authentically. Because you can understand, if the papers are getting published based on the chat GPT generated data, so what is authenticity? Just for sake you are doing, you it got published also in a very good journal and people start practicing it. There will be the cases that it will going to backfire, because that is not actually verified, because nobody has tested that in the lab, nobody has done the experiment. So there are repercussions to it. So I think as a responsible individual, we need to understand as a professional, that AI is there to make my work easy, not to you can say do my work. It is just acting as an assistant to help you to do your things faster, to help you out in framing things in a better way, but not to replace your work, not to replace your intelligence, I will say. Because I think creation cannot be better than the creator. I always believe that. It's just like a tool. Treat it like a tool only. So have a, you can say, more authenticity. Have trust on yourself. Don't think that AI is better than you.
That's true.
So definitely use of AI, but with a caution.
Thank you, Sir. Barsha, you can wrap up.
So thank you. Any
Yeah.
other questions? So otherwise we can wind up.
I think we can wind up so we can have more of a hands-on workshop as we discussed, because
Yeah.
this is a topic cannot be finished in 1 hour or 2 hours. Definitely. Thank you so much, sir. Thank you for your time, and the way you have given dental examples is really commendable. Like being a non-dental person, you have given very accurate examples. I am telling you,
Thank
it's really
you.
praiseworthy. So thank you so much, sir. Thank you for
Thank
your
you.
time.
Thank you, everyone. Thank you for
Thank
having
you
me.
so much, sir.
All the very
Thank
best.
you for the session.
Welcome.
We'll end the session today. Thank you, all the participants.
Okay. Have it. Good evening.